Okay, good morning. So we are going to talk about the question number 2, part B, OET reading exam. So the question number 2 is, the notice is giving information about. We already discussed the method that you have to read the question first, then you have to read the paragraph. Then you have to look for the options A, B and C and find out the correct answer. So that's your method. So the question is, the notice is giving information about. So what is the notice here? So the notice is NG feeding tubes. So displacement of nasogastric feeding tubes can have serious implications if undetected. So from the first sentence, this is talking about displacement of NG tube, and it has serious complications. So incorrectly positioned tubes, that means displaced nasogastric tubes, leave patients vulnerable to the risk of regurgitation and respiratory aspiration. That are the two conditions that it is talking about, the complications of displacement nasogastric tube. So it is crucial to differentiate between gastric and respiratory placement on initial insertion to prevent potentially fatal pulmonary complications. So it is talking about the importance of checking where the nasogastric tube is. So otherwise other complications is pulmonary complications. Alright, so insertion and care of an NG tube should therefore only be carried out by a registered doctor or nurse who has undergone theoretical and practical training and is deemed competent or is supervised by someone competent. Assistant practitioners and other unregistered staff must never insert NG tubes or be involved in the initial confirmation of a safe NG tube position. So the last two sentences is talking about who all can insert an NG tube, who all can assess an NG tube. Okay, so then we are going back to the questions now and find out the correct answer of the question number 2. The notice is giving information about option A, ways of checking that an NG tube has been placed correctly. It not talking about the ways. Okay, so from that it is clear that it is not the correct answer. We can strike out the first one. So then you will check about the second option, B, how the use of NG tube is authorized. So it is not talking about any authorization, so we can strike out option B as well. So probably then the C is the correct answer from that, because you striked out already the option A and option B. So even though you have to check whether it is correct or not, just read it. Option C, which staff should perform NG tube placement. Okay, the last two sentences of the paragraph is talking about who all can insert an NG tube. So that is the right answer. Okay. Thanks for watching our video, and please visit www.oet4u.blogspot.com and please subscribe our channel.